We will discuss the last part of this lecture, pre-implantation genetic testing. The testing of embryo before implantations in IVF procedure. Basically, in the IVF procedure, before implantation, you have to do pre-implantation genetic testing so that you get a proper embryo. Those having no aneuploidy, no chromosomal abnormality, so that you get a good embryo transfer. Those having a recurrent risk of aneuploidy baby or any abnormal baby. Purpose is detect the chromosomal abnormality to prevent implantations of affected embryo. So there are types of pre-implantation genetic testing: PGT-A, PGT-M, PGT-SR. PGT-A is aneuploidy. Previously, pre-implantation genetic screening में they have get aneuploidies. For aneuploidies, pre-implantation genetic testing for monogenic or single gene disorder. Previously, PGT they are telling. Pre-implantation genetic structural arrangement. Previously, PGS translocations. So indication when we go for a pre-implantation genetic testing. So indications of pre-implantation genetic testing: you have a higher age of female patients. Suppose patient's age is more than 40, so that can be an indication of pre-implantation genetic testing. If you history of recurrent pregnancy loss, in that case you can go RPL is also an indication. Repeated IVF failure also indication, because there's some chromosomal abnormality that baby is gone mad and the embryo is gone mad and is got IVF failure. Either male factor infertility, and patient with family history of X-linked disorder carries 25 risk of having an affected embryo. In that case, mental or physical problem of offspring occur due to chromosomal translocations. Carry autosomal recessive disease carries 25 risk of having an affected embryo. So in that cases, you can go for this pre-implantation genetic testing. Any carry autosomal dominant disease carries 50% risk of having affected embryo in that cases. If you autosomal recessive, very important. If it's recessive, 25%. If there is 25% risk, then you will go for pre-GT. If it is autosomal dominant, if there is 50% risk, then you go for a PGT. HLA matching also indications for pre-implantation genetic testing. Pre-implantation PGT-A. First we will discuss PGT-A, monogenic disorder. What are the monogenic disorder? It will detect single gene disorder. Single gene disorders. What are the single gene disorder? First is your cystic fibrosis. Another is your Huntington disease. You can remember CH, cystic fibrosis and Huntington disease. Okay. The identify autosomal dominant, autosomal recessive, dominant, recessive, X-linked conditions. Use molecular techniques for targeted mutations. So basically the PGT-A has a, I told PGT-A. So PGT-M is your monogenic disorder, detects single gene Huntington chorea, and your cystic fibrosis, identify autosomal dominant, recessive, and X-linked conditions. Molecular technique have been used for targeted mutations. Then PGT aneuploidy screening. PGT-A detect abnormality in chromosomal numbers. That is aneuploidy screening condition like Down syndrome 21, Edward syndrome 30, Edward is 18, Patau syndrome is 13. This will increase the success rate of IVF. PGT structural rearrangement. Identify the chromosomal translocations, inversions, deletions. Important for carriers, valence translocations. Helps avoid implantation of embryo with genetic imbalance. Very important. Structural rearrangement, that is the structural rearrangement in any base pair. If it is A, B, C, the deletions or duplications with double B, and translocation, A goes to C and C goes to A, that will be translocations. So steps involved in the embryo biopsy. It involves three main steps in the, if you go for a pre-implantation genetic testing. Actually, you have to take a biopsy from the embryo so that you can get a testing for the screen genetic testing. What are the steps involved in the embryo biopsy? First step is drilling a hole in the zona pellucida. You have to, if this is a zona pellucida, you have to drill a hole, then remove the cell, then transport in the genetic lab. So methods of zona pellucida drilling. What are the methods? We have a mechanical methods. Methods having methods of zona drilling is mechanical drilling. First is your mechanical drilling. Second is your chemical drilling. Third is your laser assisted hatching. So basically, the mechanical drilling is a sharp. You have used a sharp micro needles for the partial zonal dissections. And very important. This is simple and safe procedure. There is no chemical, no laser. And but cons is your time consuming, technical difficult procedures. But it is a very safe procedure if you go by mechanical micro needles using drilling. Then chemical drilling, you have to, what are the chemical you are using? Acidic thyroid solutions. Very, very important question they can ask. What is the chemical used to go for a Jonah drilling? Jonah drilling use acidic thyroid solution to create a large hole in the Jonah pellucida. This is a process. This is a larger, rounder hole. And what the causes may affect embryo development due to chemical exposures. Okay. The laser assisted hatching is laser beam has been used to drill the Jonah. It is a first procedure, EG and sub procedure. The slight temperature rise costly equipment. They will cause a laser, because laser it will cause slightly temperature rise and cost. Removal of the second phase, removal of the cells. How remove? Culture media has to use standard IVF media is acceptable but depend on the embryo stage. Recommended medium is calcium magnesium free biopsy. Very, very important statement is, what is the recommended medium? Calcium magnesium free biopsy medium for cleavage stage biopsy. Biopsy timing has to be done, must be performed quickly to minimize the pH, osmolality, temperature changes. The cell used for Preimplantaion genetic, you can take a polar body biopsy, or you can take a blastomere biopsy, or you can take a blastocyst cell biopsy. The type of biopsy are based on the what are the type of cells you are taking out. What is, if you do take polar body, then polar body biopsy. If it is blastomere, is blastomere biopsy, or you can take a trophoectoderm biopsy. Okay. Then polar body biopsy, first is your definition is the a preconceptional diagnosis detecting inherited disease in the oocyte before fertilizations. Principle is genetic makeup of the polar body is complemented to the oocytes, because you know polar body also equal genetic makeup to the oocyte. So basically those diseases inherited from the oocyte before fertilization, that cases, that disease can be detected by polar body biopsy. So legal ethical use, prefer country, legal restriction on embryo research for couple with religious ethical concerns. Methods, fast polar body biopsy done immediately after egg retrievals. Once you use oocyte retrieval, day 0, metaphase 2 stage, you go fast polar body biopsy. The second polar body biopsy has to be done after day 1 of fertilizations. Removal technique is aspiration after laser assisted hatching. The limitation of this fast polar body testing only detect, because you know oocyte on polar body is from the maternal bodies, maternal oocyte, so it is a detect only the maternal genetic defects and the limited sample maternal for testing. Both polar body must be biopsy for better accuracy, requiring 2 manipulations for the embryoation. You can see this is the polar body biopsy. They're taking from the polar body. This is the polar body. This is the polar body. They're taking the polar body biopsy. So blastomere biopsy, the timing second is the blastomere performed day 3 of the post fertilization when the embryo is 6 to 8 cells. Very, very important. Blastomere has to be day 3 embryo, 6 to 8 cell stage. And the principle is embryo is totipotent at this stage, meaning removing the one cell will not affect its development. So because it has a totipotent property, so if you remove one cell, it will not affect the development of the property. So a hole is made as a Jonah pellucida. 1 to 2 blastomeres with nucleus is aspirated gently. Same what is the medium use? Calcium magnesium free herpes buffer used to loosen the membrane adhesions. Blastomere removal is done via aspirations. The limitation of this biopsy is only 1 to 2 cells are available for genetic testing, removing more cytoplasm than blastocyst biopsy. Higher risk of mosaicism at this stage can be detected. Not all embryo reach the blastocyst test, increase the cost. Poor quality embryo are not recommended for biopsy. Okay. So this is the blastomere biopsy. This is the 6 to 8 cell stage and day 3 embryo. 6 to 8 cells blastomere biopsy. Then blastocyst biopsy. This is the again the blastocyst cell has 2 cells. One is a trophoectoderm cells and inner cell mass. The trophoectoderm cells is from the placenta. The inner cell mass from the fetus. So what is the principle is trophoectoderm cells have the same genetic makeup as inner cell mass. So removing few cells does not affect the fetal developments. So methods here is the Jonah breaching done on day 3 followed by removal of 5 to 7 trophoectoderm cell on day 5. Okay, here is the day 5. Blastomere biopsy is day 3, 6 to 8 cell stage. Cell removed via herniation after laser drilling. Limitation, limited time for diagnosis before embryo transfer. Very limited time is getting. Requires skilled embryologist upon require embryo freezing for later transfer. The transportation to the genetic lab. Sample collections place biopsy cell into a PCR tube with minimal washing media under stereosome microscope. Blank control for each embryo sample. Prepare one blank control using remaining fluid after cells release. Then storage is PCR tube is a cooler rack covered with paraffin. Pack inside shipping box with ice packs. Stability during transport. Complete all form patient detail properly. What are the advantages? What are the advantages of pre-implantation genetic testing? The pre-implantation genetic, the advantage is to reduce the transmissions of the genetic disorder and enhances your embryo selections, because you have to select the particular embryo that is having no abnormality in this. Then increase the success of IVF, helps avoid multiple failed pregnancy. These are the advantages. Basically, if you stop the transmission of genetic disorder, you can enhance the embryo selection, decrease the IVF failure and multiple pregnancy failure. Limitations: false positive, negative reversible, expensive, not widely accessible, ethical concern regarding the embryo selections. So we'll discuss some case. Case 1 is G2P1 L1 33 years 17 weeks 2 days, non-consanguineous marriage, NT scan is 0.8 centimeters.